Telecare specializes in services for those with the most complex needs.
Serious mental illness that may result in significant functional impairment, persistent or chronic conditions, high symptom burden, high cost of care. Telecare's spectrum of services includes community-based, acute, crisis, residential, and longer-term recovery programs. A fundamental principle at Telecare is that our programs help consumers work toward wellness and recovery by using their own hopes and dreams as a guide. All programs are designed with Telecare's recovery-centered clinical system, RCCS, as their foundation. Let's follow a Telecare client through our spectrum of services. Meet Michael. Michael is a 31-year-old man who experiences symptoms such as hearing voices that other people don't hear, has extreme sadness with a history of suicide attempts, and struggles with substance use. Michael has been out of his medications for months and goes to one of our crisis programs for help. They restart his medications and refer him to outpatient services. Telecare's crisis programs help people experiencing mental health crises to regain a sense of stability and avoid more restrictive settings. Crisis programs are typically unlocked settings for people to enter on a voluntary basis. Our walk-in urgent care programs provide services to individuals who self-refer. Services include assessment, medication support, brief treatment, and links to community services. The typical length of stay is between 6 and 8 hours. Our crisis stabilization programs provide screening and triage, medication support, and brief treatment in a safe, protective setting. These programs are sometimes co-located with acute inpatient programs, allowing for a warm handoff transfer when needed. The typical length of stay is up to 24 hours. Several weeks later, Michael has lost his medication and housing and is picked up by the police wandering the busy streets without shoes, talking to himself, and screaming at passerby. The police take him to one of our acute programs for evaluation, where he is placed on a psychiatric hold. Telecare's acute programs provide safe, therapeutic, and secure inpatient environments for individuals experiencing a mental health emergency. Services can be provided on a voluntary or involuntary basis. Our acute programs link individuals with ongoing care in the community to prevent readmission. The typical length of stay is between 3 and 10 days. These programs are staffed by a multidisciplinary team that provides assessment, symptom reduction, medication services, discharge planning, and resources that support development. After 7 days at the acute hospital, Michael's symptoms have improved, but is determined to need a lower level of structured inpatient care and is transferred to a subacute program. He receives rehabilitative services and supports to help him successfully transition. Telecare's subacute programs are supportive, structured, and secure inpatient environments designed to help clients in preparation for a move to the community and/or lower levels of care. The typical length of stay is 3 to 6 months or longer, depending on program parameters. These programs provide psychosocial rehabilitation and emphasize skills building and linkage to community supports. Services include individual treatment, therapeutic group activities, medication support, pre-vocational and social work support. We also have 3 skilled nursing facilities which focus on older adults, those with chronic healthcare needs, and specialized programs for those with neurobehavioral disorders. After 8 weeks, Michael is ready to transition to the community program and the new boarding care home. His new community team helps him maintain his housing by teaching him skills to manage his symptoms, learn interpersonal skills, and adopt harm reduction strategies for his substance use. Telecare provides a range of services in the community for people with or at risk for mental illness. Our community-based programs are designed for people who can successfully live independently in the community with intensive services and supports. We have 3 types of community programs: assertive community treatment, full-service partnerships, and case management/care coordination programs. These programs provide services including housing assistance, vocational services, psychiatry and medication management, co-occurring disorder services, and peer services to help all clients navigate the system of care, thereby reducing use of emergency and inpatient services. After a year of successfully living in the community, Michael begins to experience an increase with his symptoms, and his case manager worries that he is no longer taking his medication because voices in his head are telling him not to. Michael does not want to go to the hospital, but agrees to go to a crisis residential treatment program. He spends 45 days there and returns to his life in the community. Telecare's residential programs provide alternatives for individuals with mental illness who would otherwise be placed in higher levels of care, such as state hospitals or acute hospitals. In home-like settings, residents address the issues and behaviors that put them at risk for institutional placement. These programs focus on skill development and community integration. Therapeutic services include community-based transitional services, recovery-focused groups and activities, medication management and education, transportation, and intensive case management. The typical length of stay is up to 18 months. We also have programs with a longer length of stay that provide individualized recovery planning, support with daily living activities, crisis intervention, family and social relationship development, and medication assistance. Telecare programs play an integral part in the mental health system of care, and we invite you to take a look at all that Telecare offers within the mental health spectrum.